practice should have a policy regarding. Okay, I'd like to get into some patient cases. I just want to show you a few people, and then I've got a video clip of a patient who underwent his surgery the day that I operated on the firefighter. This is starting out just a typical middle-aged gentleman who has some excess body weight. He's got some excess breast tissue. He's not really happy taking his shirt off, doesn't want to go swimming in public. And then post-op, looks much better. Still a big gentleman. Obviously, he's you know, got good muscle definition and all that, but his chest looks much more natural, and he's much more comfortable going out in social situations without a shirt on. This is a gentleman that I showed at the beginning of the talk. He's in his early 40s. He has left-sided only unilateral gynecomastia. Wanted nothing done on the right side and really didn't need anything. Now, some men have a worse case on one side than the other. This gentleman really had nothing wrong with the right side, and so I only operated on the left. And once again, you can see he's got this on his left side an inframammary crease or a fold underneath his breast that looks unnatural, and then you see that's resolved after the surgery. This is I put this patient in here to show you that a number of men come in with fairly minor problems. This gentleman obviously spends a good bit of time in the gym, works out quite avidly, yet he just has what we call a puffy nipple problem, where he just has basically an enlargement of breast tissue right behind the nipple areola. And you can see that, and I apologize for shadowing. There's some shadowing in the oblique pictures at the bottom of the screen, but you can see that he's got sort of a projection of the nipple areola on that oblique view on the left side, and then it's flat afterwards on the right, in the right view. So someone like that just needs very limited surgery, and Lisa's going to get into cost in a few minutes, but obviously we don't charge the full fee for a full gynecomastia procedure for someone who just needs direct tissue excision with no liposuction and mainly, like in a case like his, limited anesthesia. This is a typical case that I see, a young man who's in good physical shape, spends a good bit of time in the gym, but just has a problem with breast tissue causing an embarrassing appearance for him. And he always wears tight shirts. You can even see, I think he's kind of got a farmer's tan, if you will, because he just never takes his shirt off. And then afterward did much better. Had once again, a combination of liposuction and tissue excision, and that got him where he wanted to be. And the only scarring is really at the underside of the nipple areola complex. Another young man, once again, pretty avid exerciser, works out a good bit in the gym, and he's in his early 30s, and you can see quite an improvement on this lateral view between the before and after photos. He has that breast form with an inframammary crease, and then it's no longer present after the surgery. This is a gentleman in his late 30s that I just recently operated on. He came up from Miami. He's a young physician in Miami. Not a terrible problem, but enough that it really bothered him, and he, once again, avoided social situations where he had to disrobe or, bathing suit type situation. So here he is, post-op on the right side. You can see on the oblique view at the top, you see on the left picture a rounded, kind of a pointed breast form, if you will, and then that's resolved in the post-op picture. Once again, very little scarring, just the nipple areola area. One other thing, too, a lot of men use, plastic surgeons use drains, closed suction drains. I try to avoid that. To me, putting in a drain is going to leave another scar. And granted, the drain scars aren't terrible, but they're still a scar. And people come in to me because they want to have a great-looking chest. They don't want to have any kind of visible scars, and putting a drain in is just going to leave a scar. And I've had good success with this combination of liposuction and tissue excision without having to drain the patient. I have a number of patients who come in during their early college years or late high school years. They have the surgery, and then I may not see them again for post-op pictures until much later. And this is one of the patients that's in my photo album that I show people in the office. He was around early college age when I did the surgery, and then it was about 4 years later when he came back and I got his post-op pictures. So believe it or not, it's the same patient, but he looks a little bit different because he's about 4 years older and he's physically matured. This is another young man who has had surgery just recently. You can see it's not a terrible problem, but enough to be problematic for him. You can see in the oblique picture on the bottom left that he's got that puffy nipple appearance, kind of a projected breast appearance, and then that's resolved post-op. And he was very happy with the result afterward, and has done very well. Another gentleman, this gentleman's in his early 40s. He's from Cocoa Beach. He spends a lot of time fishing. He doesn't like the appearance of his chest, but it didn't keep him from going out on the fishing boat without a shirt on. So I may see him later for skin cancer surgery. I don't know, but too much sun, but that's part of living in Florida. But anyway, he got a good result. Once again, you can see in that bottom left picture a really distinct inframammary crease, truly like a breast form, and then post-op, he looks much better. Now, I've got a video. I think, Matthew, this is our post-op patient. The patient before the last one actually came into the office about a week ago, and he's a gentleman that I operated on when I filmed the other young man. So he's done very well, and I just want to show you our interaction at his last visit. Okay, we're here with a patient, a post-op patient who had his gynecomastia surgery about 6 weeks ago, and he's doing fine. You can see he's got a nice flat chest. We recorded his surgery, and you can see quite a difference when you compare with the before photos. He looks a lot better. He's got nice pec muscle definition because he's in good shape and he works out a good bit. But he no longer has that breast form, that breast shape. Nipple areola complexes are flat. He doesn't have the puffy nipple problem that he talked about pre-op. Go ahead and flex your muscles for me. Flex really hard. You can see he's pretty flat. There's not a whole lot of subcutaneous fat here. Okay, you can relax. So overall, he has a much improved shape. You feel pretty comfortable with your shirt off going out to the pool and whatnot?
Yeah, day and night difference.
Yeah, good. Any problems after the surgery at all?
No, just a little bruising from the lipo probably.
Okay.
That was about it.
And you said there wasn't much pain for after a few days?
Yeah, after the first 3 days maybe. It's probably the worst.
Okay, all right. And we talked earlier about the gym. He's already ready to go back to the gym. He kind of misses his workouts. And I usually tell people no workout with weights, upper body weights, for about 6 weeks. But he can now go back without any restriction, do whatever he wants. Okay? Very good. Okay, I wanted to show you one more patient. As I mentioned earlier, some people who are really either morbidly obese or very old and have a lot of extra skin would never get a good result from classic liposuction and then removal of breast tissue through an incision on the underside of the nipple areola. If you look at this young man, believe it or not, he's only 17 years old, and this may look like a pretty drastic way to go for him, but there's no other way to really correct this. And if he lost weight, possibly, but he was pretty much desperate at this point. His parents came in with him. He was not motivated to do anything. He couldn't lose weight. He didn't want to lose weight. And so I presented this to them. Now, unfortunately, I haven't seen him back since the first post-op visit, so I have to show you pictures with steri-strips in place. But that shows you how long the incision is. You have to get rid of all of that skin, and the only way to do that is to basically remove that whole envelope of skin with all the breast tissue. Now, if you look at his nipple areola complex pre-op, it's very large, very feminine looking. Well, he doesn't need all that, so I just trimmed it down to a very small diameter, and then that's what you set aside, as graphic as this sounds, and then put it back at the end of the case to stitch it in the right position. So here he is on the right side about a week after surgery. He's ecstatic. He's very happy. And just to let you know, a little follow-up, although I don't have pictures to support that, he went on to lose about 25 pounds. He's just been on a cloud, very happy, and he's finally gotten motivated to drop weight. So to me, even though this is a pretty drastic measure, it's a great result, and we've got a very happy patient.